A community-based intervention program has improved the lives of some people battling spinal cord injuries in and around Cape Town. The physical activities focus on improving cardiovascular endurance, strength, flexibility and the functional performance of individuals. It's being run in Mitchell's Plain, Strand and Macassar. The program was developed by the Cape Town Biokineticist as part of her doctorate.
The resolve to live a normal life. Despite being wheelchair-bound, they are determined to overcome their physical and mental challenges due to spinal cord injuries. An intervention by biokineticist Dr. Vermaak has thrown them a lifeline and has given them a new approach to life by simply exercising. Vermaak believes there's a lack of rehabilitation for people living with spinal injuries once they are discharged from hospital.
I just realized that there's a big gap between inpatient rehabilitation and outpatient health and wellness. I just saw a lot of people getting rehospitalized because they're not coping with their injuries once they are discharged from hospital. Within the hospital, they've got so much assistance. They've got physios and OTs and social workers. And once they are discharged, they don't have that support system anymore. And then they get rehospitalized because they're not ready to be in their communities.
Many of these individuals were not always wheelchair-bound, but horrific car accidents have left them paralyzed, forcing them to relearn simple movements, and for many it's been a difficult journey.
You lose your independence. First of all, you have to rely on other people to do things for you. That's the most difficult part. But I mean, one can overcome it if you get the right help from the right people, patient people.
For 28-year-old Carlo Klink, it's taken 8 long years for him to relearn simple tasks like brushing his teeth. But he's seen great life changes since joining the program.
I couldn't move my hands, I couldn't brush my teeth, I couldn't brace myself. But now, when I started at the scope 2 years ago, I can do basically anything by myself. Now I can eat, I can keep a fork, I can keep a knife in my hand, I can brush my teeth on my own, I can brace myself.
Dr. Vermaak is training other people with disabilities and volunteers to implement such programs in areas like Kayamandi and Cluttersville in the Boland area next year. Loggenberg-Roberts, SABC News, Macassar on the Cape Flats.